As a psychiatrist who specializes in treating OCD, there is one core belief that I keep hearing from my patients that always stops any progress in their recovery dead in its tracks. And it's this: I don't think the usual treatment is going to help me. And I've tried everything there is to try. And here's the thing: it gets people feeling stuck for many years and even prevents them from seeking help. So today I want to explain why OCD and anxiety in general does this. And if you've ever found yourself thinking, yes, sure, but my OCD, my anxiety is different, then this video is for you. But before we get started, for those of you new to the channel, welcome. I'm Dr. Robert. I'm a board-certified psychiatrist, and I specialize in treating OCD and anxiety spectrum conditions. And as always, these are just educational videos, not medical advice. If you are experiencing any mental health symptoms, please seek the care of a local mental health care provider. So let's start off with a quick story. I got the idea for this video when a resident, a former colleague I was working with years ago, told me a story recently. And he's still in training, and he was seeing a patient in a very renowned OCD clinic where I had received my training. And the patient had come in, had traveled across the country to be seen in this clinic for their severe OCD. This person, he had brought these many documents chronicling their symptoms, their intrusive thoughts, and how it was so unique, different, and severe, because he was sure nobody else could help him. And when he was in the waiting room and the resident showed up, a trainee, not the attending in the clinic, he exploded. He was furious. He traveled all the way across the country, got a hotel, expensive flight just to see this one psychiatrist. And I was going to be seeing a trainee. He wasn't having any of it. But as the resident gathered the patient's history, it became very obvious to him that, sure, this patient's OCD had its unique quirks, but it was still just like any other case. And yet they had this strong belief that their case was somehow unique, somehow would be treatment resistant and very severe. And just hearing this story reminded me of the many cases I've had over the years of people coming in and being very certain that their case was the exception. And this is one of the most common tricks that OCD has up its sleeve. It's making you believe that you're alone, making you believe that, sure, exposure response prevention works for some people, but it won't work for you. Sure, medications may reduce some people's symptoms, but for you, it's not going to do anything. And you may have tried a few medications, but what's the point of trying others? You're alone. You're not going to get better. And that's how OCD survives. And those of us trained in treating this condition, we hear this all the time. I sometimes even conceptualize OCD as this thing that's almost foreign to us, this sort of like virus or a parasite infecting someone's mind. And it wants to survive. It doesn't want to be found. It doesn't want to be treated and killed off. So it wants to survive at all costs. And this is one of the most potent weapons and defenses it has against that. Let's take a step back and explore why it feels so personal, why everybody's OCD feels so unique to them. Because on some level, it is true. No two people have the same exact case of OCD. That's because your life is unique, and your experiences are your experiences alone. And OCD is particularly adept at exploiting your own experiences, your uniqueness against you, because it evolves through your experiences. To help better explain this, I like to go through an analogy. Imagine two identical seeds, same genetics, same everything, but one is planted on a windy hill, another one by a river. One survives a storm, one grows in rocky soil. And they both have different challenges, different experiences as they're developing. And so, one has very different branch structures, very different thickness than the other one, despite being the same exact seed. And that's the same thing with OCD. It can be the same exact thing, but given the environment, different experiences, it can form in very different ways. So someone can develop contamination OCD after developing a serious illness as a child. Someone else can develop OCD around the religious themes after growing up in a very strict religious household. Or someone who's had any trauma growing up may have recurrent intrusive thoughts around safety and checking things multiple times. So the themes can reflect your life, though of course this is not always the case. So yes, your story is unique, and OCD is unique because of it, but its underlying mechanism is not. Because what's happening in your brain and the way it manifests as behavior, intrusive thoughts, reassurance-seeking, that remains pretty much the same. So another analogy, bear with me, is I try to explain it as like an ice cube tray. You might have various shapes that the ice cubes can form in because of the different trays, but it's still always water and ice, so it's the same substance taking on different forms. And with OCD, as I've mentioned many times on this channel, it's the same thing, right? It's an intrusive thought or sensation, a degree of uncertainty, and then some compulsions to find reassurance, satiate that sense of unease or something not feeling just right. And it just becomes a cycle that goes over and over again with rumination, obsession, compulsion. And OCD has another way of making you feel unique, and that's A disproportionate sense of danger that's attributable to your own experience. Let me explain. So it can have you thinking that you will be the one that will get into an accident. You'll be the one that something really bad happens to. So even though there's something that could happen, and it's a very small percentage, it gives you a disproportionate sensation that will happen to you. So this is very common around health OCD. People really having a strong, intense sensation that they'll be the one to get this very rare disorder, that they're the one whose mild ache is the symptom of something very severe, even though that's the case in very rare situations. Or oftentimes if there's like an outbreak of Ebola, people will think that, well, they'll be the first one to get it from touching something on a subway station. OCD often whispers to you, the statistics don't apply. You'll be the exception. You'll be the one. So what do we do about this? What provides the turning point in people's recovery? Well, what's the common question OCD asks? It's what if, what if, what if? And here's the beautiful thing. We don't need to know what if. And once we start working on that mindset shift, that we don't need to have certainty. We don't need to know that you will or won't be the 1 in a million, that your case isn't the most unique, or perhaps it is. We don't need to be certain about that. We don't need to have an answer. Once you're able to start to accept that slowly but surely, things start to feel less loud, feel less intense and urgent. You approach the question of maybe I am the exception, maybe I am treatment resistant, maybe I'm not. Maybe this will be forever, maybe it won't. Maybe I will be the 1 in a million, maybe I won't. You don't need to know, and teaching your brain that it doesn't need to find out. And that's a big part of exposure response prevention and ACT therapy. Even the question coming up of do I have OCD or not is a very common one, and it gets people really stuck as well. And taking that same approach can be helpful here too. Well, it doesn't matter if you have OCD or not. These strategies still help with the anxiety that comes from these questions, from the anxiety you are experiencing. So it doesn't matter. We'll still take the same strategies because they still work. And in the end, OCD doesn't even want certainty around, are you the unique case? Will you get better? Do you have OCD? It doesn't actually care about the answer. What it really wants is your attention. It wants you to pay attention to that question. So as with the patient I mentioned in the intro, and many other cases with OCD, a big question, a helpful question to ask yourself is, if I weren't wrestling with this thought, with this uncertainty, with this potential danger, what else could I be focusing on in my life? Would it be hobbies, friendships, exercise, work, whatever it is? When your attention is trying to get pulled by these intrusive thoughts, these uncertainties, bringing it back to whatever it is you're trying to focus on, the thing that gives you value in your life. If you'd like me to make a video that dives deeper into this and different questions that come up with OCD, definitely let me know in the comments below. I'd love to make it. I hope the main takeaway is this. Your brain is not uniquely broken. You don't have a very unique case of OCD that's treatment resistant or that nobody's ever heard of. I'm sure if you see a specialist, they've heard of it, and there are ways of managing it for you. But being open to it, being okay with not struggling with the uncertainty, those are some of the first steps to helping you along the path. And thank you so much for sticking around to the end. I greatly appreciate you. Please like and subscribe, and hope to see you next week for another mental health video. Thanks.